Hey everyone, welcome back to the channel. Today we're diving into a medical topic that might sound a bit intimidating, but is actually more common than you might think. Cellulitis. No, I'm not talking about cellulite, the skin dimples that people often worry about. No, cellulitis is something entirely different and can be serious if not treated. So let's go on a journey together to understand cellulitis, its causes, symptoms, and how it can be treated. Picture this. It's a sunny day and you're out in the garden. You accidentally scratch your leg on a thorn. You think nothing of it, clean it up a bit, and go on with your day. But a couple of days later, that scratch starts to look red and swollen. It feels warm to the touch, and it's a bit tender. You might shrug it off, but what if I told you that this could be the start of cellulitis? Cellulitis is a common bacterial skin infection that affects the deeper layers of the skin. The bacteria usually get in through a break in the skin, like a cut, scrape, or even something as simple as a bug bite. But what's going on under the surface? Let's get a bit scientific for a moment. The main culprits behind cellulitis are bacteria, specifically Streptococcus and Staphylococcus. These bacteria are usually harmless on the surface of our skin, but if they find a way to sneak in, they can start causing trouble. Once they're inside, they multiply and release toxins that cause inflammation. That's why the skin becomes red, swollen, and painful. This infection doesn't just stay on the surface. It can spread quickly and affect deeper layers, which is why cellulitis should never be ignored. So how do you know if that red, swollen patch on your skin is cellulitis? Here are some common symptoms to watch out for. Redness. The infected area usually becomes noticeably red. Swelling. You likely see some swelling around that affected area. Warmth. The skin may feel warm to the touch. Tenderness or pain. The area can become quite tender and painful. In some cases, cellulitis can cause fever and chills as your body tries to fight off the infection. If you're experiencing these symptoms, it's important to seek medical attention. Now let's talk about treatment. The good news is that cellulitis is usually treatable with antibiotics. Most cases will resolve within a week or two once you start on the right medication. Your doctor may prescribe oral antibiotics, and they'll typically ask you to monitor the area closely. But sometimes cellulitis can be more severe, especially if it spreads quickly or doesn't respond to oral antibiotics. In these cases, you might need intravenous or IV antibiotics in a hospital. Prevention is always better than cure. Here are a few tips to reduce the risk of cellulitis. Keep wounds clean. Always clean cuts, scrapes, or any skin injuries right away. Use soap and water, and then apply an antibiotic ointment. Cover and protect. Keep wounds covered with a bandage until they're fully healed. Moisturize regularly. Dry, cracked skin can be an entry point for bacteria, so keep your skin hydrated. Take extra care. If you have a condition like diabetes or a weakened immune system, be extra vigilant with any skin injury. By being mindful and taking these simple precautions, you can significantly reduce your risk of developing cellulitis. Alright, that's a wrap on today's video. Cellulitis might seem scary, but with the right treatment and a little prevention, you can keep it at bay. If you found this video helpful, give it a thumbs up and hit that subscribe button for more health-related content.